Welcome to this year's protocol update class. This is the 2023 Kentucky State Protocol updates. You guys have already seen from Dr. Lovers the determination of death protocol. Some big changes there, so that's pretty interesting. The next thing we're going to talk about is trauma triage, a little bit of change from the last set of protocols. The last set of protocols had an algorithm that, depending on the patient's injury patterns or vital signs, kind of told you what level of trauma center they needed, whether it was level 1, 2, 3, or 4. This trauma triage guideline is the new updated 2021 national guidelines. It's a little bit simpler, so we'll dive right in. So you'll notice on the protocol that there's two categories pretty much, or two criteria, or two categories of criteria, I guess is probably the better way to word it. The first one, the top one, is the red criteria, or these patients are high risk for serious injuries. On each side, you'll notice one side's injury patterns, the other side is different vital signs that are considered red criteria. On the left side, you have the injury patterns, so any patient with a penetrating injury to the head, neck, or torso, or proximal extremities, skull deformity, suspected skull fracture, suspected spinal injury with new motor or sensory loss, chest wall instability, deformity, or suspected flail chest, pelvic fracture, fracture of two or more proximal long bones, crushed, degloved, mangled, or pulseless extremity, amputation proximal to the wrist or ankle, active bleeding requiring a tourniquet or wound packing with continuous pressure. Those types of injury patterns are going to meet red criteria. And then on the right side, the vital signs include a GCS less than 6, respiratory rate less than 10 or greater than 29, respiratory distress or need for respiratory support. So the kind of patient that you're bagging or using a BVM on, or room air pulse ox less than 90. If they're younger than 9, if they have a systolic less than 70, plus 2 times their age, or systolic less than their age appropriate systolic blood pressure. Ages 10 to 64, systolic less than 90, or heart rate greater than the systolic blood pressure, or 65 and greater is a systolic less than 10, and also a heart rate greater than the systolic blood pressure. These are red criteria patients. You'll notice at the bottom below the criteria, any of these patients should be transported to the highest level trauma center available within the geographic constraints of the regional trauma system. So for us, that means activating air medical response and flying them out to either UK or UT, depending on weather and where PHI or whatever flight service comes to you decides. So that's the red criteria. We'll move on to the yellow criteria. These patients are moderate risk for serious injuries. So some examples of mechanism of injury include a high-risk auto crash with partial or complete ejection, significant intrusion, death in the same compartment, unrestrained child, or unsecured child safety seat, vehicle telemetry data, rider separated from transport vehicle with significant impact, so rider separated from motorcycle, rider separated from ATV or horse, etc. Pedestrian or bicycle, rider thrown, run over, or with significant impact, fall from height greater than 10 feet. That's all ages, not just adults. On the right side, you'll notice there are some EMS judgment calls you may have to make. Those include low-level falls in young children, so ages less than 5, or older adults, so greater than 65, and those are falls with significant head impact. Patients on blood thinners, possible child abuse, patient with special health care needs that may need a lot of resources, pregnancy greater than 20 weeks, burns in conjunction with trauma. It also notes that children should be triaged preferentially to pediatric capable centers. If you have any concern at all, it says to take to a trauma center. If they meet these criteria and they don't meet red criteria, then it's preferred that they get transported to a trauma center. as available within your trauma system. So for us, it's probably going to be our local facility, St. Joe. So um, that's pretty much the new criteria. Here is the hospital map, and we'll cover that in the next section.